We are back with Dr. Stacey Blyth. She's talking about the importance of getting primary care. Okay, so this is one of the stumbling blocks, right? Sometimes we just don't even know how to go about finding a primary care provider. So kind of walk us through the process there.
So I work with Cone Health, as you've already said, which is a great not-for-profit system in our area that covers multiple counties, 5, I believe. And we have set up on our website, conehealth.com/primary care as a really good starting point for how you go ahead and go in and figure out who's in your area, who has availability. So that's a really good starting point. Word of mouth is always good. Every system has access, but that's certainly how we do it. Beyond that, it really becomes a matter of sort of talking to friends and figuring out what works for you. But conehealth.com is a really, really good starting place.
All right, so what would you say to people who think they can just go to the emergency room and just use that for their primary care instead?
So mostly I would just address the fact that, as we all know, insurance deductibles, co-pays, access is just getting trickier and trickier, right? An incredibly high percentage of the American population has medical debt, and high cost care like that is really a big piece of it. So there's so much that we can do in the primary care setting that's going to be a nickel and a dime compared to what you'd have to pay for in the ER. And as we all know, with COVID, our emergency rooms have also been just absolutely overrun. We only have so many rooms, so many docs, so many nurses, and we really have to save those services for people who are truly in dire straits. And then we need everybody else to help us get them established with a primary care doctor so we can take care of the simple things before they're big things and keep them out of the emergency room, which is a much scarier, much more expensive proposition.
So when someone is preparing like for their first primary care appointment, what things would you recommend they do for a successful visit that they can prepare ahead of time before they go in?
It's a great question. So the biggest thing is just really, write yourself a list of the medical conditions you think you've had. Do your best to pull together your family history to the best of your ability. Pack up your meds and bring them with you. I want to see those bottles if I can. If you've had screening elsewhere, especially if you've moved to the area from somewhere else, so I can't go through my computer to kind of grab stuff from people nearby. Any copies of any reports you have, bring them with you. But the biggest thing is really make sure that you're ready to ask your questions so you get your needs met, and then be prepared to then establish a relationship with me, and we start a cadence for how we start working on what you need.
Yeah, and bring all of those other things that you take, like supplements and stuff too. Bring those, even though they're not prescription, because she needs to know them.
Absolutely, they interact with some of your meds, and I take supplements. I'm not anti-supplement, but the reality is just because something's natural or not prescribed doesn't mean your kidneys and your liver don't have to metabolize them, and there can be consequences from time to time. So I need to know, to take good care of you, everything you're taking, so that I can really give you a full picture of what I think it's safe for you to do and not do.
Right. Okay. Just how important is it to get an annual physical with your primary care provider? Not just going in for the aches and pains, but an annual physical.
Right. So that's a great question. And in my medical journals, we debate that from time to time. But I think in the end, we're very social creatures, and medicine's a very social proposition. Yes, we need to know the science, we need to have the information, but there's an art to it. And if you have an established relationship with the cadence and you come in for an annual visit, and last year you're getting older, no falls, this year you fell once, let's talk about that. Let's figure out what happened so we can get you some physical therapy, adjust some things in your home. And by doing sort of that annual cadence, or more often, if you have more conditions, we're going to find the little stuff before it's big stuff and really keep you out of trouble for longer. Because if we're all lucky, we're going to age. And with age comes more sort of upkeep.
And when we have that annual exam, we get all those numbers back, we should probably be asking questions. I know it says it's in the normal, but is it high normal? Should I be doing something else?
That's right. And the trick is, if we have that established relationship where you're comfortable asking that question, the reality is some of your numbers come back and they don't worry me at all, but you don't know that. So you have to ask, MCHC is this little statistic around your red blood cells. Since I did pathology in med school, not a concern, right? But if you don't have that relationship with me to ask it, you're going to worry about it. You're going to Google it and scare yourself. So if we have that right, Dr. Google is a menace when it comes to mental health in that sense. I'm all about people engaging in their own care, but it stresses people. So yes, ask the questions. There's never a stupid question.
That's right. Ask your doctor all the questions. All right. If you missed any of this information, we're going to publish it in the To Your Wellbeing section on our website.